One of the things about TM that I've been particularly impressed with is the amount of quality research that's been done in that area. In fact, there are over 340 peer review articles. Now, for those who may not understand what a peer review article is, it is sent into a journal where peers who are in the area, experts in the area, look the article over, determine that it's a quality product, make comments, make suggestions, which the author then has to incorporate. And only after those steps is that article published. And having been both a journal writer and a journal reviewer, I can attest that it's quite a rigorous process. So the fact that there are 340 or more articles in multiple different areas means that there's a very substantial body of research on this particular technique. A lot of it is very impressive. One area that is particularly interesting is the cardiovascular area, where there has been a repeated reduction in blood pressure, a reduction in cardiac mortality, and mortality in general. And it has occurred to me that if a pharmaceutical company had a pill which was capable of doing all of these things, they had all these studies that showed how much help it could give, that pill would be a billion-dollar blockbuster.
The big breakthrough came this past June when the American Heart Association published its scientific statement, first ever scientific review on alternative methods to lower blood pressure. And in this independent review of all the published scientific studies on mind-body interventions and other alternative interventions for blood pressure, they said that amongst relaxation and stress reduction and meditation practices, only the transcendental meditation technique is effective in lowering blood pressure. So this is like the discovery of a whole new class of treatment that's not yet been discovered by modern medicine, but now has. That's the big discovery. A whole new category of intervention, and again, through self-healing mechanisms. This is empowering to patients, that not that you have to rely on a pill with its side effects and cost, and even with a pill, you stop taking it, and your blood pressure comes back, or your high cholesterol may come back. Here's a way to deal with health of the cardiovascular system in a holistic way, in a natural way, in a self-sufficient or self-empowering way, and in a way which deals with the cause, the more causal level, or more of the root cause of the condition, dealing with that mind-body connection, dealing with the contribution of stress to the heart disease, and even more fundamentally, by restoring the body's own homeostatic or self-repair mechanisms. And that has long-term comprehensive effects, not only for physical heart health, but studies have shown improvements in emotional heart health, because the brain and the heart are connected. This was a mind-body-heart tour, so lower emotional distress, greater physical heart health, as well as positive side benefits in other areas of health and well-being.
I've been in practice, medical practice, for 22 years, and I've seen over 10,000 patients. And in that time, my number one recommendation for just about every patient has been learn the Transcendental Meditation program. Because what I've experienced as a physician is that we have to address the root cause of their health problem. And we know there's an epidemic of chronic disease in this nation right now, and what's behind it is the wrong behaviors, and what's behind the wrong behaviors, the wrong diet, not enough exercise, all of that. It's stress. It's mental stress. People get overwhelmed, and then they don't do the right thing for themselves. And what I found in my practice is that when people do TM, the mental stress starts to melt away, really melt away, and they become more calm in themselves, and they start spontaneously to make better choices in their lifestyle.
Last week I had a patient came in who is being treated for heart disease. He has plaque in the arteries, he has high cholesterol, he has high blood pressure, and he is on medication. Now this is what I do as a cardiologist. I treat people and try to prevent them from getting worse, try to prevent them from having heart attacks, strokes, try to prevent the disease from taking their lives. Well, here this gentleman, under so much stress, all of a sudden he started eating, gaining weight, his blood pressure is going up, his cholesterol is going up, and he comes into my office. Doctor, can you help me? Well, it's very easy for me to take a pen and a prescription pad and write him for higher doses, give him more medications, but how can I do that without addressing the underlying problem? How can I say to him, I'll just give you more drugs, when the problem comes down to stress? I very confidently, very easily said, we have to take a new approach. We have to add something to your treatment regimen. And I recommended transcendental meditation, because now I will be treating the underlying problem. It's true that he might need more medication, more doses. We might have to change things around from the medical perspective. But if I don't prescribe TM, if I don't say to him, you need to address your stress, I'm not being a good doctor. I'm not taking care of him as a patient. I believe in it so strongly that about a year ago, I started doing it myself. I'm one of those people who had no time, had too many lists, had lists upon lists, and decided this couldn't possibly be for me, but I would try because I understand the effects of stress. And with my mind going in 25 million different directions as I sit down to do TM, all of a sudden, when the 20 minutes is over, that list is linear lined up and I'm ready to go. I recommend TM for myself, I recommend it for my patients, and I say it with the backup of all the studies, all the research, and with the American Heart Association saying this has been proven to reduce heart disease, stroke, and hypertension.
My name is Dr. Gary Kaplan. I'm a neurologist in practice at ProHealth in New York, and I'm a clinical associate professor of neurology at New York University School of Medicine. I've been practicing the TM technique since I was a freshman in college, and I noticed from the first meditation, whether I was trying or not trying, just naturally, calmness, a kind of peace came over my mind, and a sense of relief, and a real quietness in the physiology as well. We know the mind and body are intimately connected. With transcendental meditation, we have a mental technique, a very simple, effortless, natural mental technique. We experience a thought on quieter and quieter levels of the mind in a very natural and spontaneous way. And what's happening, since the mind and body are intimately related, physiologically, we have a profound change. That is, that the physiology starts to gain a type of rest that is different and in some ways much more profound than the kind of rest that it gets during deep sleep or during dreaming. So the body enjoys this unique, profound rest while the mind expands and settles down and gains this heightened alertness. So this is what, as scientists, we call a wakeful hypometabolic state, or in other words, a state of restful alertness. And naturally, easily maintaining the state of restful alertness during the TM technique allows the body to rejuvenate in ways that otherwise it would not be able to. Transcendental meditation, the technique interests me as a doctor because I'm always looking for something that can help my patients that's free of side effects. So with the TM technique, fortunately, we don't have these side effects. And there's a very good reason why we don't, because it's a very natural technique. It's just allowing the mind to settle down the way it really wants to and allowing the body to gain that rest. So it's free from side effects, but instead it has what we like to call side benefits. Many benefits in the area of health, psychological health and physiological health.
It's a miracle because I can meditate. I'm a type AAAAA personality. I make Soledad look like she's hypothyroid. I'm the best thing that ever happened to TM because if I can do it, anybody can do it. And so I decided to do it. And I have to tell you, first of all, I'm the first research scientist at the senior fellow level in the Office of Alternative Medicine at the NIH. That was my Jekyll and Hyde thing. By day, she was wearing her white coat and scrubs and working on regular patients. By night, she was with the Office of Alternative Medicine, and that's where I met Herb Benson of the famous relaxation response at the Harvard University Mind-Body Institute. And I am their most spectacular, most famous failure. I lasted 11 seconds. I couldn't relax to save my life. You could have given me the $500,000, or the $500 million for the lottery. I still couldn't make it happen. I don't know, whatever. When the student is ready, the teacher appears. So when I finished the work with Norm's book, it was very interesting. So I marched in to the people, Mario and Linda, down at the Bethesda TM Center, and I warned them ahead of time. I said, I'm coming. Now, as I sat down, I said, we have rules. Okay? If I see any candles, I'm out of here. Okay? I'm not changing religions. I kind of like mine. It's a little flawed, but, it works. Right? We're not sharing. No circles are forming. Stay away from me. And I just finished a triathlon, so I have hair on my chest. So don't mess with me. And Mario stood up and he said, Dr. Peak, we knew you were coming. We were ready for you. We have a customized form of meditation for you. We call it warrior meditation. I said, yeah, I like that. Let's sit down. Let's rock. Then I said, 20 minutes? And then a small miracle took place. It fit like a glove. And I haven't stopped, and it's been 1.5 years. And it's been fantastic.
This is a life or death situation. Too many people are killing themselves because of the trauma. And I'm very grateful, and I very much want to be able to prescribe TM in the AM and the PM. When I prescribe medication, there's almost always some type of side effect. With TM, there's only benefits. When I prescribe a medication, they're invariably going to try a second or a third. It does not lead to self-sufficiency. TM can lead to self-sufficiency and discharge from the clinic. I saw a 23-year-old this last week. He had already left his wife. He was failing in school. And as he sat there, it was like he was running in place. He was so anxious. He knew 2 of his other Marine buddies that had already killed themselves. He had nearly killed himself. I'm not over-dramatizing. This is a life or death situation, and we need to get the help. I want to be able to prescribe TM, and I thank the Foundation for the help. Thanks.
I talk about transcendental meditation because in my experience that teenagers can do it very easily, and when they do it in just 10 minutes twice a day, what they experience is that they actually have a center, they have a core of peacefulness and happiness inside them that they can access. And the more they do it, the more they find that they're less reactive to stress. When they do get stressed, it goes away faster. They generally sleep better, they find it easier to eat and get through life. And these kids simply need antidotes to these tremendous stressors. Including the drugs and alcohol and sleep deprivation. Our top priority in educating kids should be creating environments that aren't unduly stressful to be in, and helping kids develop brains that function at a high level of efficiency. And much more important than what they're taught, what they know, is really having brains that work in a healthy way and being in an environment in which kids feel safe. And I think that if we think about what are the real dangers of as kids get older, particularly as they grow into adolescence, what are the real dangers? And there are things like kids making bad decisions, kids losing motivation, kids getting depressed, kids developing eating disorders or self-injury, really worrisome things, kids abusing drugs or alcohol. All these things are highly related to stress. And if we see transcendental meditation correctly as a beautiful tool and a very easy tool to use for normalizing the stress response, providing deeper rest, all these things get better Kids who are less stressed are significantly less likely to get depressed. They're significantly less likely to use drugs or alcohol, to cut themselves, to burn themselves, all the other things that we worry as kids get older can go wrong. And my feeling is that there's nothing more important than helping kids develop nervous systems that work well, that can learn well, and that feel good.
What I would say to anybody who is interested in accessing other states of consciousness is try it out for yourself. Because when you step into that transcendent space, you're in a place where there are no boundaries, time seems to dissolve and disappear. Who you are, where you are, doesn't seem to matter. You're very alert, but you're very relaxed, but you're not thinking of anything in particular, and yet you're awake. You're not sleeping, you're not dreaming, you're just there. And while you're there, you're filled with a wonderful feeling of goodness. A feeling that somewhere inside yourself there is this wellspring of good feelings waiting to be accessed. It's almost like when you see in the movies where they hit oil and the oil starts gushing. That's how it feels when that wellspring of goodness is tapped into and suffuses you and fills you with that good feeling.